Hi, everybody. Thanks for joining us for another Healthy Hour. I'm here today with Marylou Mercado, she, her, hers. She is a community health educator from Planned Parenthood, Pasadena, and San Gabriel Valley. Thanks so much for joining me today, Marylou.
Yeah, thank you for having me. I'm super excited to be here.
Yeah, we're going to be talking about some interesting stuff today about birth control and contraception. But of course, before we get started with that, my very first questions are always about my guest. So, Mary Lou, tell us a little bit about your journey to becoming a community health educator.
Yeah, definitely. So I am from this area. I was born and raised in the San Gabriel Valley. And then when I graduated high school, I got to go to see Santa Barbara, where I majored in sociology and philosophy. And those two majors have really guided like what I want to do with my life and how my passions in professional environments. During my time at UCSB, I really focused on education. I worked for some programs. I worked with youth, middle school, high school. I worked with college-aged youth. So again, a lot of my professional experience was based in education. When I graduated, this opportunity came and I felt it was a really good fit because it had that component of education, being a community health educator, but also, I grew a lot of passion for public health in sociology and philosophy and how it really intersected with so many other issues that are in people's lives and how essential health is. So this opportunity came and I just felt like it was a really good fit, my passion for education, my value alignment with Planned Parenthood and the mission of Planned Parenthood and how that is connected to me. Um, and again, that educational background really supported the skill sets I needed in being able to speak to people and understand people and listen to people. So I got really lucky and I got the job and I felt it was a really great fit too because I really got to work in the community that raised me. I love getting to work in San Gabriel Valley. Of course, working anywhere is amazing, but particularly the community that I'm in is super special.
That's totally true. I mean, that's fabulous that you're able to come back and help out your community. And I think public health right now is so
Yeah,
visible. And thanks so much for working with college students. And that's exactly the population we're going to be talking to today. So this
yeah.
is perfect for you.
Yeah, and I definitely feel some relatability to just the communities I work with because again, I was part of this community. I am part of this community, and I was raised here. And I think that representation of being someone from the community and working with the community is really nice.
Definitely. And that absolutely makes a difference knowing your community and being a part of it. So you mentioned Planned Parenthood. So what do you do as a community health educator for them?
Yeah, so my main responsibility is centered around really providing education, medically accurate, inclusive sexual health education. And that's going to be with a variety of different populations and kind of working with that population to make it age appropriate. So, with middle school, kind of talking about like consent and friendships and, that early foundational things, finding a trusted adult. Going into high school, starting to touch more on contraceptives and anatomy and learning more about the body and identity. And again, also with college age youth as well. And then conversations around like what we're talking about today. And again, consent is a really big popular topic in college campuses.
Mhm.
So direct education is my primary role. And right now, really trying to utilize ways to reach people in a socially distant way. So via Zoom, via social media, via podcasts like we're doing right now. But yeah, my main job is just really providing that education and that outreach in the community.
Then I really hope that our video today really reaches out to a lot of people because it's such a big topic. You've listed so many topics, and we're going to come back. We're going to do this again about all the other topics. Consent, I totally want to go over that. But today we're talking generally about sexual health. So it's such a, it can be such a touchy subject for a lot of people, even in college age students. How do you prepare yourself for answering these kinds of questions?
Yeah, definitely. I first like to know I understand my parameters as a health educator. I am not a doctor, I'm not a lawyer, I am a health educator. So I always like to preface people with reminding them that sometimes I don't have the answer to questions and I can refer out, of course, to an appropriate space. But really it comes down to practice. I practice these questions beforehand. I try to inform myself as much as I can beforehand. In addition to also just really being a compassionate listener to the questions and not being judgmental of questions, really approaching every question as it is. I really do not believe in any dumb questions when it comes to sexual health, because I know a lot of people don't hear about this every day. And this is a topic that is new to them, that they're still trying to figure out how to talk about. So it just comes down to practice and compassion and listening. And my like mantra when it comes to this job is, yes, I am an educator, but I get educated so much more than they educate. I get educated more than I educate, because I learn so much in the questions that people ask me and in the stories that inform the work that I do.
That's I love that. I really like that idea because it's so true. As a teacher, I think I learn just as much from my students as they learn from me, and that's exactly what it should be. It's a shared space. It's a learning opportunity, and I think with something as touchy as sexual health, it is important to have that shared, trusted space between the two of you. So that's fabulous. I really like that. Thanks for sharing that little mantra you
Yeah,
have.
of course.
So today, oh my gosh, today's topic is on birth control,
Yeah.
contraception, everything related to that. And so let's get a little bit into the basics. Let's start with the basics. So, what are the most common concerns or the most common questions that you get when you get asked about condoms?
Yeah, so there's a lot. So with birth control and condoms, there's so many misconceptions that come around. I would say the most popular question is around like brands and like myths around like whether a brand is better or not, is it more effective? And really, brand comes down to like personal preference and comfort. So not there's no one brand that is more effective. It really comes down to the way that someone uses it. Someone may prefer a brand, and again, that's a personal decision that they make with themselves and in discussion with their partner. But if a condom is used correctly, following the steps, then the condom will be effective. So again, also not knowing about how oil-based lubrications can affect a condom as well.
Uh-huh.
It can actually damage the condom and make it a lot less effective. So there's a lot of misconceptions around like whether someone can use an oil-based condom, a oil-based lubrication. And we recommend water-based or silicone, as that's gonna make sure that the condom is intact and it doesn't get damaged. With external condoms, so there's actually two types of condoms, external condoms that go on the penis, internal condoms that can go in the vagina and the anus. First, knowing the difference. Really, the really important things for someone to know about an external condom, which is, let me show what an external condom. So this is an external condom. This tends to be the packaging that people are familiar with. Of course, consent, always making sure that all parties are agreeing to what is happening. Checking an expiration date is going to be really important. A lot of people don't know that condoms expire. So that's going to be a really critical step in making sure that the condom is effective. And also checking for air in the packaging to make sure that the condom hasn't been broken or damaged is going to be really essential to making sure that it's effective. Another step that people tend to forget that's really critical is going to be pinching the tip of the condom before placing it on the penis. And that's because if there's no space for the semen to go, if there's an ejaculation, there's likelihood of spillage, which can put someone at risk of pregnancy and or STI. So those are some of the most common steps that are missed with an external condom. And this is an external condom. Now, this is an internal condom packaging. A lot of people don't even know that internal condoms exist.
Yeah.
Yeah, so there's misconceptions because they don't even know they exist. But this is, again, can be inserted in the vagina or in the anus. It's made out of a different material than latex condoms. These are, I believe, nitrile. So if someone has a latex allergy, this could be a really good option for them. And yeah, so this is an option. And again, a lot of people don't know about it, and it can be more comfortable for a person. Might prefer it. So it's always just good to just be informed of the different options that someone has.
So a few follow-ups to that. You mentioned the difference between oil and water-based. Why do we not want to use oil?
So oil can damage the latex condom. And if the condom gets damaged, then it's more likely to tear or rip during sexual activity. And of course, if it rips, that fluid contact can put someone at a risk of STI and or pregnancy if possible.
Okay, thanks. And then I know we're going to talk about this later, but I just want to make sure that our audience knows, how can they get those? Can they get those internal and external condoms from you?
Yes, so external condoms, we provide at Planned Parenthood for free. Someone doesn't need an appointment to go. They can just go to the health center, ask for some condoms. They get a bag with 12 condoms, and then they're out. It's pretty quick and easy. Internal condoms can be a little bit harder to find because they're not just as popular, they're not as readily known. At Planned Parenthood, we unfortunately can't provide them for free because of funding, lack of funding in internal condoms, but we are able to sell them to people at a reduced price. So we do have those available as well. Internal condoms, again, are kind of hard to find in stores, but they are available on Amazon as well.
Okay, good. Thank you. So condoms are the most common method of protection, right?
Yeah.
So what about some other long-term uses? Because condoms are one-time use only, but what about some long-term ones? And can you tell us a little bit about the effectiveness of them compared to condoms?
Yeah, definitely. So condoms, again, the most well-known because they do protect against STIs, which unfortunately hormonal methods do not. And I'll talk a little bit through that as well. But yeah, so first worth noting with long-acting reversible contraceptives, that's a term for a birth control, hormonal birth control that can be used for a long period of time. The first is the IUD, which I have actually right here. So it's just this right here. Yeah, short for intrauterine device. This is about 99% effective and is inserted into the uterus by a medical provider. And I forgot to mention, this can be effective for about up to 7 years at preventing pregnancy. So it's pretty long term. Then there is the copper IUD, which looks kind of similar. It's in here. It looks very similar to the other IUD, except this is a non-hormonal method. So for someone who may not want to use hormones to prevent pregnancy, this can be inserted to help reduce the risk of pregnancy. Also 99% effective. And this one's actually good for up to 12 years. So this is one of the most long-acting reversible contraceptives available. And then we have the implant, which is right here, a little rod that's inserted into the arm right about here by a medical provider. Also about 99% effective and effective for up to 5 years. The reason these are so effective is because they really don't require much from the person using them. Condoms, are every time use. They need to be used correctly in order to be more effective, and they're more prone to human error. This is really, once they're inserted, the person doesn't have to do much because there's low risk of human error, which is why the effectiveness remains kind of high. Yeah, so those are the most long-acting contraceptives available, and they do not protect against STIs, which is why it's worth noting that someone may want to pair a hormonal method with a condom so that they're able to protect themselves against pregnancy and STI.
So the rule is, regardless of what birth control method you use, condoms should always be a part of it to prevent STIs.
Yeah, condoms are really essential in preventing STIs, and worth considering if someone is worried about STIs. And although I like to mention, not everyone can get pregnant if they're being sexually active, but everyone is at risk of an STI if they're being sexually active.
Right. That's true. That's true. So you mentioned hormone methods, you mentioned condoms. So what about for those who are not interested in a hormonal method, what are their options?
Yeah, so again, the most popular, let me rephrase that. The most long-acting non-hormonal method will be the copper IUD, like I mentioned. Again, this is for someone who has a uterus. It is inserted into the uterus by a medical provider. And this uses, instead of using hormones, uses copper to change the pH levels in the uterus where sperm can't really function. Therefore, they have a harder time swimming to an egg if they're not functioning correctly. So that's how it uses hormones to prevent, does not use hormones to prevent a pregnancy. So this is an option as a long-term non-hormonal method. Some people may choose to utilize withdrawal, often known as the pull-out method, when someone chooses to remove the penis from their partner before an ejaculation. That is something that someone can do to try to prevent a pregnancy, but also worth noting does not protect against STIs. And because withdrawal is really dependent on behavior and being precise, it's more prone to human error. So that's why it tends to not be the most effective way at preventing pregnancy, because it has to be used correctly every single time. But that is a non-hormonal option that is out there for a person. And then of course there's avoiding vaginal sex or abstaining as a non-hormonal way of preventing pregnancy. It is 100% effective. There is another method, the sponge and spermicide. It's a little bit of an older method, not as popular, but if someone is trying to prevent pregnancy, but they don't want to use hormones, that's another option available to them.
Okay. So there's a few. Because I know that some are not interested in the hormones, but they do, of course, want to protect themselves and they want to make sure that they stay safe. So it's good that they have these kinds of options.
Yeah,
So
definitely.
I know we're talking about contraception and preventing pregnancy, but of course, as you mentioned, the effectiveness levels are totally different depending on which one you use. So if you do have sexual intercourse and it does lead to the possibility of pregnancy, or there's an issue, an accidental issue, what can somebody do to prevent that fertilization, that pregnancy from happening after
Yeah.
they've already had sex?
Definitely. So of course, like you said, things happen, effectiveness rates can change depending on use. So there is a couple options for people after they've been sexually active. Maybe they didn't use a condom, maybe they used a condom and it broke.
Hmm.
Maybe someone is on the pill but has been really forgetful, or they've skipped a couple pills. There's all kinds of situations that may
Hmm.
arise. The most commonly known is going to be an emergency contraceptive pill. There's over-the-counter pills that can be purchased like at CVS, Target. Most commonly known, Plan B. So this is Plan B. And then there's also prescription emergency contraceptives that a doctor can provide, for example, Ella. Worth noting with our emergency contraceptive pills, first thing I want to address is Plan B is a brand, Plan B is a brand of emergency contraceptive. A lot of times they're used interchangeably because they're the most popular brand. But there's other brands like eContra Easy. I think Costco has like their own brand of emergency contraceptive. They all do the same thing. Plan B is just the brand. So one brand isn't better than the other. So if someone chooses to purchase a different brand, that's going to work as well if they use it accordingly, which is usually about up to 5 days after unprotected sex. And I like to mention that too, because sometimes Plan B is the most well-known, but also the most pricey sometimes. And so if someone finds an emergency contraceptive that's $25, which there are, versus like the $50 pill, they're both going to work as long as they're using them as directed. So that's the most commonly known option. There's also the copper IUD that I brought up earlier, can be used as emergency contraceptive as well. It can be inserted up to 5 days after sex, and it can be used to prevent a pregnancy from happening, and can stay there as a long-acting reversible once someone has used it. So that's another non-hormonal option for people. I think it's definitely worth noting that there's a lot of misconceptions around emergency contraceptives, and emergency contraceptives prevent a pregnancy from happening, do not terminate a pregnancy. So if someone is already pregnant, they take a Plan B, they're already pregnant, Plan B isn't going to harm their pregnancy. If it's meant to suppress ovulation so that someone is unable to get an egg fertilized. So I like to make that distinction: pregnancy prevention, not pregnancy termination. And again, some key other things is that it doesn't protect against STIs. So that's something to consider. Maybe if someone didn't use a condom or the condom broke, they may want to consider also getting tested for STIs if there was contact with fluids.
Okay. That copper IUD is really useful in a lot of
Yeah.
different options. So
Mhm.
that's great. So you've given us so many options. You've listed so many things. It's been so informative. Um, what do you what's what do you think? What do you recommend?
Yeah, so it really is going to come down to different people's needs. I get that question a lot as a health educator, like, what do you recommend?
Mm-hmm.
Um, and, I can definitely talk in terms of like how something is used and how effective, and some are going to be more effective than others, and some protect against STIs and some don't, and I can inform on that. But it comes down to a person's individual needs and kind of identifying what some concerns are and what they're looking for. So maybe I'm a person who is just incredibly forgetful. The thought of taking a pill every day kind of stresses me out. I want to take that into consideration and talking to my medical provider and letting them know I don't want to take something every day. Like, that's something I don't want. Or if I don't want to take hormones, that's something I can bring up to my medical provider. Um, the implant and the IUD are really effective, but maybe I'm the type of person that just doesn't really like the idea of having something inserted into my body. Um, Totally valid concern. All of these are all valid concerns. And I think it really comes down to, again, talking to your medical provider, advocating for yourself and saying, this is something I'm in looking for in a birth control. This is something I'm not looking for in a birth control. Let's talk through it and see what might be a best fit, because what's a best fit for my best friend might not be the best fit for me. So again, it's so personal that I always say that's really down to you and your medical provider.
That's so true. And every person, every body is different, and every body will take things
Mhm.
differently. So it's important to keep trying to find the one that works for you specifically. Um, in regard to that, every body is different, so everybody will take in the issues with birth control differently. So I get the question of like hormones. There's all these side effects. I don't want these. So what are the concerns? The common concerns that people could have in terms of side effects.
Yeah, that's again another really popular question that I get from folks who are interested in going on birth control.
Hmm.
As you expect, like many medications that you may go on, everything may come with some side effects, and that's super valid to talk through those and think about those. Methods with hormonal methods in particular, can impact someone's menstrual cycle in a different way. It can, maybe some methods may regulate a period, some may make a period more irregular, some methods may um, make a period lighter, some methods may make a period heavier. The interesting thing though is that, again, the chemistry of everyone's body is so different, where like my best friend may experience one change to the menstrual cycle, I may take the same method and my body may feel a totally different thing.
Hmm.
That's kind of it. It can sometimes be like a trial and error, like
Hmm.
each person is different, but it can affect someone's menstrual cycle. And again, if I really don't want an irregular period and there's a method that tends to provide an irregular period, worth bringing up to my medical provider. Like, that's a concern. Um, Another concern is that about future fertility. Very
Hmm.
common concern is, will I be able to get pregnant in the future? And hormonal birth control does not affect future fertility. There's been a lot of research around this, and it's been shown to not affect future fertility. And really, if someone, for example, is not using their birth control as directed, they may become pregnant on birth control. And again, effectiveness rate is not 100% other than abstaining. So there's always that risk of becoming pregnant. So it doesn't affect future fertility though. Um, Also, worth recognizing that side effects do tend to go away after 3 or 4 months. Um, and so that's like worth thinking about, like, okay, it tends to be like a 3 or 4 month time period of some side effects. But of course, if in those 3 or 4 months, it's really not working for you, you have every right to go to your doctor and be like, hey, this isn't working out. Let's talk through maybe a different option. Um, so those are some pretty common concerns that I get. Um, Also, just like to remind people that hormonal birth control needs a medical consultation. You can't just go buy a pack of pills or go buy an IUD. You have to talk to a doctor beforehand. You have to talk through it to make sure that you may be a good candidate for birth control. And I bring this up because you can't take your friend's birth control pills if they ask you um, if they can take them. You have to talk to a doctor to just make sure to address these concerns, these potential side effects, and that you're able to make an informed decision. Um, and with birth control, there are some side effects and there are some benefits as well, aside from pregnancy prevention. So some people do take birth control to help them regulate their period, not necessarily to try to prevent a pregnancy. Certain birth controls can be used to help control acne if someone struggles with really bad acne. So there's also just a lot of different factors when considering birth control.
So there's a lot of different things to think about, and there's so much we've learned so much so far. You mentioned talking about it with your healthcare provider and being an advocate for yourself as a patient. Can you tell us a little bit about that and what the importance of being an advocate for yourself?
Yeah, definitely. So just again, you know your body more than anyone else, and you know what your needs are, physically, mentally, and where you're at. And I encourage people to first look into different birth control methods beforehand, going down plannedparenthood.org. There's websites like Bedsider that are really good at just providing some surface level like information to worth knowing. And then when you do talk to a doctor, like again, really speaking on what you're worried about, asking those questions. I know sexual health can be kind of hard to talk about and totally understandable. If you maybe feel a little bit shy, totally valid, but I encourage you to really, again, address those concerns, address your needs with the doctor. Maybe the most effective one might not be the best one for you. So again, an IUD, really effective. For some people, that's going to be the most important thing. For another person, like I mentioned, maybe they just aren't comfortable having an IUD inserted in their body. And it's worth saying, hey, I'm not really comfortable. Let's talk about a method that maybe is still effective, but I don't have to have something inserted. So just again, bringing those concerns to light, asking questions. You are your strongest advocate. You know yourself better than anyone. And if you're on birth control and something isn't feeling right, you're not liking the symptoms are too much for you, telling your doctor like, hey, this isn't working out for me. Let's talk through maybe another method if this isn't for me.
Thanks for saying that. I think it's super important to have that conversation with your doctor, just that back and forth. And
Mhm.
again, that learning together as opposed to being told what to do. That's
Yeah.
absolutely super important. So we talked a little bit about where students can access condoms, but what about you mentioned that you can get a Planned Parenthood. So is Planned Parenthood available right now?
Yeah, so I know it's been a crazy year, 2020, but we are still open during the pandemic. When in March these shutdowns hit, we realized how, our patients' reproductive health is essential and it's important to still be there for them. So we were able to launch telehealth for our patients, in which we currently are able to see the patient first via Zoom and kind of talk through whatever they need to talk through, whatever their concern is at the time, and then minimize the amount of time they spend at the health center if they do have to go to the health center. So if I am on a birth control consultation, I can talk through my concerns via Zoom. My medical provider can talk to me about all the different options. And then once I've decided on a method, if it's the pill, I can just go to the health center, pick it up and leave. So just really short time there. And if it's an insertion that needs to happen, I can go and have my insertion but be done as soon as possible. Kind of all that beginning steps, all the questions, the information is done at home so that people still are in a safe environment and they don't have to spend too much time outside of their home. So we are still here. We're still serving our patients. Our patients are always going to be super important to us. So I always just like to let people know, if they want to make an appointment, pppsgb.org. They can go online to make the appointment. They can call us 626-798-0706. That's the number to call, ask questions, make appointments. Definitely if people have questions around like payments and insurance and how can I access these services, they can call that number and they will talk them through the best way to access the services. Yeah, we're still open. We're still here.
You're still located in Pasadena on Lake and Belvedere, right?
Yeah, that's the closest one to PCC.
Great. I do just want to mention as well that if you're a student at Pasadena City College, you're paying the health fee. we're here as well to help you. So when Marylou talks about medical providers, we have them. Please talk to our medical providers. They're happy to talk to you about
Mhm.
all these questions. And we always refer to Planned Parenthood in Pasadena if they have more in-depth things than what we can do. But we are here for you to help with, and it's super important that students know that they have these resources for them. Mary Lou,
Definitely.
thank you so much for joining us today. I do want to, you have some social media, so I want to make sure that
Yeah.
people hear about
So
it.
please feel free to follow us on Instagram at PPPSGV, just to stay updated on what we're doing, resources, educational information. Just a great way to stay in touch with your local Planned Parenthood. Feel free to give us a follow. Yeah. And I'm super thankful to be here. I love getting to work with college students. I know it's different this year, but outreach with college youth is still super important to me. So I
Mhm.
really appreciate being here.
Yeah, no, absolutely. And such a topic like this, as a doctoral student, I love sexual health. It's one of my favorite topics as well. So this is a great conversation. Thank you so much, Mary Lou, for joining me today. And thank you, everybody, for listening. So for the next Healthy Hour, I'll see you all next time. Take care.
Thank you. Bye
Bye.
bye.